Hi, welcome to this week's product review with John and Lou. I'm John Flucke, and plain Jane to my Tarzan of the jungle is my good pal and fellow vine swinger, Lou Graham. Lou, you know, as part of the Catapult group, I got a chance with you to evaluate Doxa's Ceramir cement about a year ago, and it has been a completely eye-opening experience. Tell me your experience with Ceramir, and let's talk about it.
From this little unknown company out of Sweden, Doxa only sold through Shine, comes a cement that we evaluated, and the initial evaluation, there were some guys who really didn't love it because of the way you had to literally activate it and triturate it. You were one of them.
It's capsule-based, like a glass ionomer, so you have to do the activation, trituration, then put it in the dispenser and put it in. And I love self-etching resin cements, and I was a squirt, as we say, squirt and insert. Put it in the crown, put it in the mouth. And I thought, oh my gosh, I've got to do all these extra steps. But the reason that I am so passionate about Ceramir cement now is because I couldn't have been more wrong. It's a game-changing product.
Game-changing product. So for the audience who hasn't heard of this product, the kit comes, and it's an inexpensive kit. You literally get an activator that activates the material.
Right.
Then you triturate it for 5 or 8 seconds, depending on the dosage. And then after rotating the capsule, the system comes with its own insertion gun. You just load up the crown and insert. The beauty of the technique is it's an opacious white material. And after 3 minutes, you have 3 minutes of, really 2 to 3 minutes of working time.
Right.
You can cement multiple crowns. And the beauty is the assistant, or you simply clean like a resin ionomer cement and it peels right off.
Yes.
You gotta love it. You're not worried about premature, you're not worried about a gel. After 3 minutes, you just peel it, very simple. So what makes this cement so unique? I'm glad you asked.
Yes.
Okay, why we're all totally into this is because this is a biomimetic, bioactive cement. It's based on calcium alumina, and what happens is this cement, as it goes through its 3 minutes of, let's say, changing, it literally becomes so adhesively a part of the tooth. So it's not bonded.
Right.
It becomes part of the tooth. So this unique crystal.
And it's self-curing. It's not light cured or dual cure. It is a self-cure cement.
So it actually just becomes part of the dentin in an alkaline type, base type formulation. And so at the margins, you want it to be acid resistant. So to the dentin it adheres, and at the margin it seals. And the studies are unbelievable. It's more retentive than a self-etching or a self-adhesive cement.
Right.
And it has less micro leakage than any cement on the market.
And what about sensitivity? You put these things on, are the crowns sensitive?
And I'm going to tell you, the patients routinely in my operatory, they're not numb, so I can cement and know the occlusion's dead on. And I'm going to tell you, they will say, if they've had other crowns done,
Yes.
it's literally an OMG, I didn't even feel that crown going in. So to me, if what is, let's say, the holy grail of cements, if you can have a cement with low solubility, easy to clean up, it's very, very thin, it's absolutely no sensitivity, it's got great retention, creates new appetite.
I would say go about the bioactives part about the whole hydroxyapatite thing.
So this cement is part of that new bioactive area where biodentin and other products are, and it literally allows the tooth to become, the cement to become part of the tooth and create new appetite crystals. If you can create new tooth and seal a tooth, I'm telling you, that's the beauty of this. Now, let me just say, I started this with zirconia crowns and PFMs. And the beauty part is you don't prime your zirconia, you do nothing. You clean the zirconia, and I use IvoClean, you use IvoClean.
Absolutely.
I do the same for my PFMs.
Yes.
And now for Emax crowns that are properly prepared, I'm telling you, I cement all my posterior restorations with this one cement.
Well, and then let's talk to the folks too about the whole thing of, you know, what are the limiting parts of it? In other words, what restorations can you not cement with this? Because that is a big piece of this as well.
It is. In the anterior, any what I call minimal preparation, forget veneers, forget inlays and onlays in the posterior. And if you're doing a minor preparation, like one of those really ultra thin crowns,
Yeah.
you gotta bond them in.
Right.
You gotta bond them in. But you're doing zirconia to porcelain in the anterior, PFMs in the anterior, even Emax in the anterior, that's properly prepared, you're
Yes.
just not gonna even see the cement. And so I gotta tell you, easy to clean up, incredible seal, and so technically easy to use. This is why this is a game changer. And with the technology, this is going to be the first of many products I really believe coming out of Doxa
Yeah.
in Sweden.
Well, and the other thing that I really like about it is that it doesn't stain at the margins at all. And when
Right.
you're dealing with resins, you always have that kind of risk. And a lot of us now, when we're preparing, are preparing just a hair, super gingival, because if you can get away with that and it looks beautiful, why not? It's better for the tissue, it's better for the patient. But there's always that thing of, okay, I bond this thing on, and then what if I get a little marginal staining? That's not what I want. This stuff does not stain at the margin.
And the last tip I'll say is you want to, when you apply this to the tooth, the cement goes on a moist tooth.
Yes.
There should be no blood, but this is such an easy technique. You just have somewhat of a moist tooth. This is hydrophilic. It wants to be on a moist tooth, and you don't have to deal with doing anything but cleaning the Emax, cleaning the ceramic of zirconia,
Right.
or cleaning the metal. It is that simple to cement.
Okay, last thing, tell them how long it takes, since it is only a self-curing material. Tell them how long it takes for it to cure fully.
I really like to let it set up for about 2.5 to 3 minutes, and then we start the cleanup phase, and it just peels right off like a resin ionomer cement. So easy. My assistants do all that. It's white. You see it. You're done. With that, thanks so much for your time. More tips, tricks, and truth in product review in the next episode. Thanks for joining Tarzan and Jane.